the U.S. has been a leader in developing private sector healthcare and developing innovative models. And so we have certain models where I believe there could be interesting opportunities to partner with the large NHS trust hospitals or foundation hospitals to bring efficiency and quality if we can tailor the model to the need of the UK market.
And how much do you think you can improve that service for us in the UK?
We work together to improve together, and I mean, I can give an example of one of our portfolio companies has been able to save in orthopedics, for example, 25 to 30% by bringing in a certain model that's been very, very successful in the U.S. But I mean, I think in the end, it's by partnering together in the UK, by bringing some of the best of the US and partnering with the best in the UK and working together to see if we can, you know, continue to enhance quality of care, because that's number one, but to bring some cost efficiencies. Because in the end, the goal is to take every dollar or every pound that you can save and reinvest it in patient care.
So how much do you think you can bring to the new system?
I think we will be looking at a specific model, like an opportunity by opportunity. It's not, there's no overall solution. So an example of one area that we're focusing on is single specialty outpatient surgery. I think remote medical monitoring. I think bringing efficiency in terms of home care is a very interesting area. And looking at some of the high-cost areas and seeing if they can be managed more efficiently.
With the benefit of your experience, I mean, how much do you think it'll benefit the National Health Service in Britain to have this increased competition and competition from international providers?
I think competition is always a positive. But I'm coming from the private sector and I manage a healthcare venture fund. So I believe that if you do something well, quality rises to the top. And this is part of what's implied by globalization. So we've been doing a fair amount of work looking at the Middle Eastern markets, particularly in Abu Dhabi. And what's interesting as we learn more is, you know, there's a real appreciation for the British model, and there's probably more than even the American model. But in the end, if countries like India, for example, are trying to solve their healthcare problem, they'll take small pieces, but their market is very, very different from, in terms of standards that maybe Americans wouldn't accept, maybe the British wouldn't accept. So everyone is looking to solve the healthcare problem, but bringing innovation. And so we actually benefit by sharing knowledge. And so competition, my view is competition is a very good thing if managed appropriately.
And how can Mills and Reeve help you in terms of what you're trying to achieve in the UK?
Well, I think Mills and Reeve is a fantastic firm because of the breadth and depth in terms as it relates to healthcare and the number of lawyers here. So in the early 90s, we when the UK and the NHS was going through another wave of reforms, we looked, we were trying to find the right law partner, and we could not find any firm that really truly specialized and understood healthcare services. Now, obviously, that was 20 years ago, but I think it is very impressive because Mills and Reeve is out all over the country as opposed to just being a London-based firm. And we have been very, very impressed. So as we have brought one American company to the UK, and we're looking at the market, and we also have a European-based company that's looking at increasing their business in the UK, Mills and Reeve has been a clear #1 player with fantastic lawyers. And we're very, very picky.